Psoas technique. The Psoas technique is helpful for clients who have one leg that's functionally shorter than the other. If the leg length difference is due to a structural abnormality, meaning that the bones are actually longer on one side than the other, this technique will not be useful. However, such structural abnormalities are rare. With the majority of your clients who have any leg length difference, this technique will be very effective. With the client supine, measure the person's leg length by pulling down on the heels and placing the medial malleoli together, with your thumb at the base of each malleolus. If one leg is shorter, work on the short side. This usually means that the person's psoas muscle is chronically tight on that side. Performing this therapy on the psoas muscle can help even out the leg length. Stand at waist level and place your footward hand on the client's thigh just above the knee. Once the other hand is in position, you'll be rocking the thigh by gently pushing medially and letting go like this. Practice this rocking action with me for a moment. This allows you to move the psoas from its attachment to the medial thigh below, instead of moving the hand directly over the psoas attachment to the spine, which would create much more discomfort for the client. With your other hand, make a loose fist and place the heel of your hand on the anterior superior iliac spine, or ASIS. This will help guide you to the psoas attachment. Then place your proximal interphalangeal joints, also called PIP joints, in line with the lateral edge of the spine, where the psoas attachments are located. This is lateral to the bulge of the rectus abdominis muscle. The middle of your hand should be approximately at the level of the navel. Sink down slowly until the client feels a small amount of discomfort, and hold that position. Now, with your footward hand, begin to rock the thigh medially and allow it to swing out laterally by itself. At the same time, use your headward hand to maintain a constant pressure on the psoas attachment to the spine. As you do this, gradually change the pressure from the center of your fist to your index and middle finger knuckles, and then toward the fourth and fifth knuckles, rolling slowly to different parts of the psoas. You can also move your entire headward hand up and down as needed. For an individual who is sensitive in the psoas area, you can begin more gently with these two modifications. Start by using the heel of your hand to apply pressure on the psoas attachment. This is much less intense and warms up the area. Then, after a few minutes, try switching to the knuckles. Remember, there should only be mild discomfort. This tells you that you are using the correct amount of pressure. In addition, you can perform this technique with the knee bent. It relaxes the more superficial abdominal muscles so that moving through the muscles and the abdominal contents is less difficult for the client. You can perform the technique with greater depth by using your fingertips instead of your knuckles. In this case, to change the focus of pressure, just move your hand slightly up or down along the psoas attachment as you continue to move the psoas by rocking the thigh. Don't roll through your fingertips. This technique is more intense than the others, so keep an eye on the client's face to make sure that you're not applying too much pressure. Sometimes they grimace, but they don't tell you it's too much pressure. It often takes 2 or 3 treatments using this psoas technique to get the full correction. After you've done this for a minute or two, go back to the feet and firmly grasp the foot on the side you've been working on. Then shake the leg on that side and apply some traction and compression in this way several times. Now pull on the heels as you did when you started. to remeasure the legs to see if the legs are more even. Repeat the entire technique up to 3 times to see if you can get the legs to be the same length. If this technique does not work, try the Iliacus, Gluteus medius, and piriformis techniques, which I'll describe next. Iliacus release technique. In the same position as before, with your footward hand on the client's thigh, wrap the fingers of your headward hand around the anterior superior iliac spine, or ASIS, onto the iliac fossa. Now compress the iliacus muscle against the bone. While maintaining the pressure on the iliacus with your fingers, rock the leg. Move your fingers slightly up and down along the iliacus as you work. This is an uncomfortable position for most clients, so go gently, moving slightly superior and slightly inferior. Gluteus medius release technique. With the client prone, bend one knee using your footward hand to hold the ankle, so that the lower leg is at a 90-degree angle. Place the thumb of your other hand on the gluteus medius muscle and apply a steady pressure. Your fingertips should be resting near the edge of the sacrum to stabilize your hand. Now, gently move the lower leg. You can swing it back and forth across the body or create a circular motion in either direction. This relaxes the gluteus medius muscle without much discomfort. Keep changing your thumb position on the gluteus medius and keep varying the motion to make sure the client is not helping you to move the leg. Do this for 2 to 3 minutes.